We are here at the Prime Health Summit. It's an honor to be here with Dr. Bynum. How are you?
Nice to be here.
Yes,
Well.
so Portfolio Director of the Colorado Health Foundation.
Yes, yes.
I thought we'd start by learning about the mission, what you all are focused on, and really your mission.
Sure.
What are you trying to solve?
As a foundation, really, I guess you could say at a 30,000 foot level, the mission is to make Colorado the healthiest state in the country. We do that with a range of different sort of tools, be it sort of grant work or other type of philanthropic work, but at a high level, that's really the mission.
And it's, Colorado is a special place. I know you moved from the East Coast and now you're here. I'd love to hear from the perspective of someone who, I know you spent a lot of time here, but also moved here. Why Colorado? What's special about Colorado? And why is this the perfect place to sort of show the rest of the world how to get healthy?
Well, it's a really interesting alignment of a lot of different pieces. You have providers that really are open and engaging when you start talking about sort of payment reform or delivery reform. You have a state that was one of the first states to embrace Medicaid expansion and trying to get services to folks that, quite frankly, need them most. And then you look at payers as, some of these payers and the pilots that they're willing to engage in. So you start to look at a lot of different players, but really with a forward-thinking mindset, it just creates an atmosphere that just pushes healthcare in the right direction.
You also do social impact investing as part of the foundation's work. What does that mean? What's the goal and purpose there?
Sure, it's really, in a sense, investing with a mission, and depending on who you are, that mission could be defined differently. For some foundations, that mission could be housing for folks that are homeless. For other foundations, that could be getting healthy food in poor kids' mouths. So it just depends on what your particular mission is how you define impact. And again, for us, it's about health. So we really want to invest in solutions as we track and monitor the impact on the health of the folks we care about.
So there's a global army of entrepreneurs that are working to solve these types of challenges. Yeah. What would your ask be of these entrepreneurs out there in the world if they were going to focus on building things here in Colorado and trying to solve some of the bigger challenges here?
I would say think about it holistically. I understand that from a customer perspective, some of the big systems may be easier targets, but when you start looking at all populations, be it Medicaid, be it uninsured, be it underinsured, those are populations as well that I think innovations must be able to sort of tap into in terms of being successful.
Does the foundation ever invest in startups and early stage companies that are trying to solve some of these health challenges?
That's so I guess why I'm here. Yeah. But at this point in time, we as a foundation are thinking through our focus areas in terms of where we want to have our impact. And part of that thought process includes how do we execute on those goals. And yes, impact investing, I think, includes some of the startup type projects, but then it also includes some of the larger for-profits as well. So I think as a piece of the work, absolutely, it includes some of the startups.
Wave a magic wand and you could have one wish. What would be the biggest change either here in Colorado or even globally that you think would make the biggest impact on health?
I think for me, it would be paying for value versus quantity of service. And that looks differently depending on who you're talking to, depending on where you are. But I think if I could wave a magic wand, it really would be around payment and reimbursement being aligned with outcomes and quality versus quantity of services delivered.
Yeah, it really is an exciting shift there with the business models, and I think that is an extraordinary opportunity. One of the things that we see is a lot of different regions around the world that have different models. So I think there's an opportunity to learn from that and bring those things back here. Let's talk about the future. Any predictions for where things go? How long does it take to make Colorado the healthiest state in in the nation here, and what do you think happens over the next 5-6 years?
Well, I think the traditional patient-doctor interaction will change tremendously. I think that the place of that encounter and being defined in the four walls of a doctor's office, those days will be sort of changing. And I don't know if it's apps in patients' hands, if it's telemedicine where there's a monitor kind of breaking down that four wall, or if it's community-based models such as school-based health centers where you start to build clinics where folks are already sort of happening and doing their existing lives. So I think as the future continues to push what we consider the traditional patient-doctor interaction, where you ask a 75-year-old disabled person with a disability to come into an office and meet you at 3:30, those days will sort of be changing a bit.
As you're out in different communities, what do people need? What do patients need? What are the biggest challenges that you've seen so far?
One of the things that I've heard, and this is feedback from the CEO at the foundation's doing her statewide listening tour, really is that mental health, behavioral health, substance abuse, that arena of need is prominent across the state. So figuring out how do we sort of bring solutions that make sense for a given community. And I say that because, in one community it may be about building a new behavioral health clinic. In another community it may be about building a crisis unit to help homeless folks get over their mental issues so they can be sort of housed in permanent housing. So I think that understanding what fits and what works in the community as you keep a common goal across is a complicated way to go about it, but I think that's the correct way to go about it.
Last question.
Sure.
What do you do to stay healthy?
I used to play college football, and shortly after I moved to San Francisco for a little while, and I took up yoga.
Yeah.
And it was something explaining to my former college football buddies that I should try yoga. It was a tough conversation, but as I continue,
more athletes are starting to do these
as
things.
I continue to it one by one, it's been yoga, man. It took me like a month before I could even start to really do it. So I would say yoga is a short answer to your question, but it was an interesting tale with my old football buddies.
That's interesting. I was at another conference yesterday in San Diego, and there were a couple of athletes there who they talked about how only a few years ago everyone would go through the same training regimen. But now, using technology, each individual goes through their own training regimen, their own recovery regimen, their own diet, and it's very personalized.
Yeah,
so I thought that was a good sort of look into the future of where we go as individuals, not just high-end athletes, but as people and how we think about our own health.
Sure.
Athletes leading the way. Well, thank you so much for everything
Absolutely.
you're doing and for sharing your wisdom
Thanks
with us.
for your time.
Thank you.